You probably know this, but besides being a professional within the aesthetic medicine world, a doctor, I am also a fully trained general surgeon. And very likely before you and I met, I was just doing surgery like a standard surgeon in the hospital, and I've done literally thousands of major operations and colorectal surgery, proctology, trauma surgery, laparoscopic surgery, also known as keyhole surgery, you name it. And I'm being blessed to the possibility of helping so many people in many different countries. But today, I'm putting my surgeon's hat and I'm gonna explain to you something that is at times feared by patients because when the word surgery is involved, it's something that we don't feel happy about that, but you shouldn't, by the way. And this concept is something known as minor surgery. And this is called minor surgery or lumps and bumps, which means basically the surgery or the procedures that we do to treat those lumps that sometimes you may have in the skin, like cysts, lipomas, skin tags, moles. I know that you've been there because I can tell you by my own experience that sometimes I feel that I help the people way more by treating those lumps that could be sometimes very annoying because they are very visible at the same level as when I used to do a lot of cancer surgery or biliary surgery. So I'm currently at one of my clinics doing this live video today. But if you follow me, come inside and I'm going to explain to you in a very plain language, in a very plain English, no medical jargon, what is this lumps and bumps surgery is about. No, definitely not. Why? Because these procedures are entirely done under local anesthesia, which means that we will numb the area completely using this local anesthetic. Yeah, you may feel a sharp scratch and a stinging sensation, that's it, but no pain. To the point that I tell to my patients, listen, if you feel anything during the procedure, please let me know because I will just put a little bit more of local, end of the problem. So no, they are completely pain-free. Well, it depends whether the procedure needs sutures or not, okay? So if you are to have any sutures at the place of the procedure, say that I need to excise a lipoma, it takes roughly 7 to 10 days and before these sutures are removed, which by the way is a completely pain-free procedure, okay? If it's something that we do using electrocautery, it may take a bit less, the initial healing. However, the entire healing process may take up to 8 weeks. That doesn't mean that you have to wait for 8 weeks to do your normal stuff. It means that in order to see the final cosmetic result, which obviously is important, sometimes you need to wait up to 10 weeks. Scarring is always a potential issue. It's part of the healing process. In fact, the scar is just the collagen that is made up by our body as a result of the injury that is produced by the surgeon, if that makes sense. All right. So even in the best hands, scarring could be possible and the cosmetic consequences of that. I always tell my patients there are 3 elements related to how your body will heal and the scar looks like. One is the surgeon, and I promise I will do whatever it takes to do the best job for you. Second is the patient, and I trust my patients and I know that they will do everything as instructed, so they will be taking care of their skin, taking care of the wound, etc. But the third factor is completely out of our control, and this is the way your body creates the glue, heals, if that makes sense. And there are certain patients that are more prone to develop what we call hypertrophic scars, which are these lumpy, raised red scars that sometimes we see in people. And when that happens, that could be an issue that may need further treatment. So yeah, it's always a possibility, but if it's done right, cosmetic results are normally very good. Yes, of course, there's no need to put you to sleep. I mean, this is not a major surgery, like liver surgery, lung surgery. No. This is what we call minor surgery, which is procedures that we do to excise lumps in the skin, little lumps and bumps, some people say. And the only anesthetic that we use is the one that we call local anesthetic, which is just an injection at the area that is going to be treated with a tiny needle, and we will inject a solution of a numbing substance, which means that just the area that is subject to the treatment will be numbed, but the rest will be completely awake, if that makes sense. And no, by any means, you will not put down to sleep. You will not need to come to a hospital. You don't have to spend overnight in a hospital. No. It's way simpler than that. It's an office-based procedure. There's always the possibility for any of these lesions to come back, to recur, as we doctors say. And there's always something that I always tell to my patients, because there's a small chance, something between 5 to 8% of cases, assuming the procedure is done right. And when that happens, the only alternative that we have is just to do the surgery again. However, let me explain this to you. Sometimes not so experienced doctors, sometimes even surgeons, don't excise the entire lesion completely. For instance, when we talk about cysts, it's important not just to get the white stuff outside, but also to take the sac that contains the sebum, the white stuff. If you leave things like the sac behind, then the recurrence is almost 100%. So this is why it's so important when you have these procedures done to make sure that your practitioner, your surgeon, is a really experienced one.